Welcome. Thank you for tuning in to the first session in the ARF Pharma Council series on trends in the patient journey, what to expect in the next 3 to 5 years. My name is Jay Matlin, and I am the director of the ARF Council program. This is the first in a series of webcasts and podcasts curated by the Pharma Council to provide the advertising community with a glimpse of what the patient journey will look like in the next 3 to 5 years, based on what we know today. So in the future, please stay tuned for more programs on self-care and home care, early detection, new delivery systems, new access points, changes in marketing, and other signposts of the future patient journey. This first entry in the series will be from Tom Edwards, who will be speaking on the evolution of experience. Tom serves as the Chief Digital and Data Officer of Omnicom Health Group. He is a highly regarded industry leader in AI, data, omnichannel, and digital transformation, and speaks regularly as a professional futurist at leading industry forums, including TEDx, Ad Age Data, and Mobile World Congress. He has won numerous awards, among them a 2021 Icon Top 10 Global Marketer Award, a 2020 CX Summit Digital Marketing Professional of the Year Award, and a 2019 Tech Titan Technology Advocate Award, among others. He was also recently named by Advertising Age as a marketing technology trailblazer. His presentation will be followed by a Q&A session with Council Co-Chair Marjorie Reedy, who is Director, Global Consumer Insights at Merck, where she has been for over a decade. A brief word on the ARF Pharma Council. Broadly speaking, its mission, as you can see here, is to identify the advertising and research challenges in the pharma industry and investigate effective strategies for contending with them. Exploring changes in the patient journey is one of its two principal priorities. The members of the Pharma Council Committee, which oversees the Pharma Council, are shown on the next slide. In addition to the Council Committee, there is also a broader Council community on pharma and healthcare, which any ARF member can join. Please contact your ARF member manager to learn more or send an email to councils@thearf.org. The Council community is sponsored by Real Chemistry. And now I will turn the mic over to Tom. Tom?
Thank you, Jay, and thank you to the Council. I'm incredibly excited to be here today. So I'm very excited to talk about what the next 3 to 5 years will look like for the patient journey. Now, I used to talk a lot about how disruption was the new normal, how different technologies were transforming how we interact and work with our world. But what I've seen over the last 10 months, you've got the pandemic combined with some certain advancements in technologies. We're seeing 10 years consolidated down into 10 months. We're seeing a convergence like never before. And what we're going to talk about today is how we navigate it. But how we're going to do it is going to be a little non-traditional. I love pop culture. I love Star Wars and gaming and Pixar movies and The Matrix. So that's going to be the frame that we're going to use to talk about all of these various trends that we're seeing that are going to impact our businesses moving forward. So before I talk about the future, I like to talk about the past. The very first movie I ever saw was the original Star Wars in the late 70s. And yes, I'm dating myself a little bit here. While my friends wanted to be Luke Skywalker or Han Solo, I love the droids, C-3PO and R2-D2, and how they seem to enable the main character's journey every step of the way. But growing up in the 80s, technology didn't quite meet my expectation here. This is the original Robbie the Robot from the Super Nintendo Entertainment System. Not quite the same as having your own C-3PO. But heading into the 2000s, I saw hope. Began to see the rise of connectivity, see the proliferation of mobile devices. And who in the crowd remember the original, anybody have the original Motorola Razr? Jay, Marjorie, anyone? So remember trying to text with that, the 3 numbers and the 3 letters? So as we get into what a lot of people call transformational innovation in 2007 with the launch of the original iPhone, I actually argue the bigger transformational innovation came in 2008 with the launch of the App Store. This is what began our obsession and patients' obsessions with personalized contextual experiences. It was one of the first times we could create our own pathway, download the apps that were relevant to us, and begin basically shifting and changing technology to adapt to us versus us adapting to it. 180 billion downloads later, and here we are. So as we think about the trends that are going to impact our lives over the course of the next 3 to 5 years and significantly impact business, I like to use 3 specific filters. Empower, that's technology and software and hardware that enables us control. Exponential is all about intelligent systems. This is about AI, this is about machine learning, how we actually apply that to our business to enhance intelligence. And the final is enhanced. This is the where we basically merge digital and physical together into a new frontier that we're going to talk about. It's going to have a significant impact on how the patient journey is going to evolve, the patient experience. So let's start with empower and control. 4 key areas we're going to talk about: Gen Z and their impact on technology, how the lens is life, how the future is private, and ultimately a bridge to intelligence. So these are my 3 children. So they're all part of Gen Z. And basically what they're it's amazing. So Gen Z was born 1996 to 2010. And they're the first mobile first generation. They learned to swipe before they learned to speak. And their preferences specifically tied to behaviorals around entertainment and technology. They spend about 2.5 hours a day with on-demand content, an hour and a half a day gaming, and about 50 minutes a day with music. Their expectations are shaping the future of how the patient experience is going to evolve across generational cohorts. So let's talk about gaming for a minute. This isn't a traditional area we think about, especially in the pharma space. So right now, I mentioned the 1.5 hours a day. Gaming is entertainment. 96% of Gen Z plays games. It's not do you play, it's what do you play? And as we think about that and how that's going to potentially impact the idea of experience moving forward, take a platform like Fortnite. Most people think of that as like a battle royale type gaming experience, but what it actually is, it's the foundation for what's coming in the metaverse. The metaverse is a concept of basically all of these kind of shared world experiences that regardless of platform you can come into, shared economies, shared entertainment, etc. But you think about how gaming now is setting the expectation, slowly but surely, that this is how the internet itself is actually going to evolve. But it's not just for Gen Z. The thing that most people don't realize is that there are 24.6 million Americans in the United States over the age of 55 that classify themselves as a gamer. The average age of a gamer is 37 years old. Think about this when you start thinking about adherence and adherence type programs. What are the different mechanics that you can put into play? What are the different entertainment properties that you can work with and collaborate with to create new and unique experiences to specifically influence that behavior? So gaming is a key area that's not traditionally considered, but one that's rapidly growing in importance every passing year. So bringing it back to Gen Z for just a moment, the camera has become the home screen. Anyone who's used Snapchat knows you start directly there on the camera. And the types of experiences, the familiarity with augmented reality filters, the ability to kind of quickly shift back and forth between how you would traditionally work with a phone all the way through to enhancing experiences. So I think about the camera as a capture device. We capture what, 400 million images a year. Also, who's taken a selfie in the last 30 minutes? Anybody? Jay, I know you have. Come on now. Totally get it. But when I think about taking it back to Gen Z for just a minute, it's a communication device, but more importantly, it's about presence. So when I was growing up and I would call my friends, on a landline with a cord, we'd have a conversation, we'd see each other in real life, IRL. Now, my daughter will be online with her friends for hours on end, but they're not always directly interacting, but there's this pervasive presence. They're just there. They can talk to each other, they can be doing completely different things. And what we've seen with the pandemic, it's kind of accelerated some of these specific behaviors. And even the expectation that millennials and Gen Zs have when they want to talk to their physician. 69% want to have a conversation 24 hours a day. So that ties into having multiple types of communication channels. And even now, the expectation around experience. We have more computing power in our hands than we did basically landing on the moon in '69. It's amazing the amount of intelligence that's now can be baked into the platform and the technology. So the expectation around experiences is rapidly evolving. and how the connection between the digital and physical world is going to continue to evolve. What I look for when I look for mass adoption of technology, it really comes to democratization. It's again coming back to the idea of control. And you're seeing platforms like Facebook and others really leaning into this. And that's applying also to private messaging. I referenced that stat around 69% wanting to have that direct connection. What most people don't understand is that private messaging passed open social in 2016. There are more messages and communication and connection, social connections happening within Messenger, within WhatsApp, Instagram, Messenger, etc., Snapchat, behind the scenes. So that's a key point to consider as we're creating conversational experiences moving forward. And you're also seeing, again, that convergence, the convergence of messaging. This is actually a representation of Kia showcasing an experience within Facebook Messenger. So you're able to connect the idea of augmented reality or different enhanced experiences directly into the messaging experience. And this is a great way when you're thinking about patient communication. You think about two-dimensional imagery that can now be recognized and pulled into a more immersive experience in a very seamless way. So that's a little bit on control and empowerment. Next, I want to touch on AI specifically within exponential. So before we jump in, we're going to talk about the Pixar theory. We're going to talk a little bit about AI. We're going to talk about virtual assistants. We're going to talk about what I call the proxy web. So this section is all about ease and convenience. That's the key. So who's heard of the Pixar theory? Marjorie, anyone? So the Pixar theory states that every Pixar movie that's ever occurred is happening on a single timeline, from The Good Dinosaur all the way through to Monsters, Inc. Now, within The Incredibles, somewhere along that rise and fall of humanity, AI is introduced in the form of the Omnidroid. And what's really interesting, spoiler alert for any of you who haven't seen The Incredibles 2 yet, but it's not about a hostile takeover. It's about ease and convenience. That's the key. So all of my research across generational cohorts comes back to the same thing. How and why patients will adopt new technologies or new experiences over the next 3 to 5 years if it makes their lives easier and if it enhances convenience. So let's talk a little bit about AI. We hear about it everywhere. It's ubiquitous. It's everywhere. And there are 3 types. There's artificial narrow intelligence. Think about your Alexa, your Siri, etc. Artificial general intelligence. This is supposed to be kind of all of the computing power of humanity into one. And ultimately, you get into the hive mind and the super intelligence, what we see in entertainment, Ultron from the Avengers. But the reality is we're in a golden age of AI and how it can enhance and drive business and specifically impact the patient journey. And we're in this golden age for 3 reasons. It's data, it's the hardware, so the cost of GPUs is decreasing, and it's the algorithms. So the ability to apply machine learning or human-coded algorithms to various problems and train the models. One thing that's very important to understand when you begin talking about the role of AI in patient journeys moving forward, AI is here to enhance and augment our intelligence, not to replace. That's a very key point of delineation. It allows us to process large amounts of unstructured data. What most people don't realize is that each individual person creates about 1.7 megabytes of data per second. And 80 to 90% of the information that's created is unstructured. So in order to find the themes, perceptions, occasions, core behaviors, and affinities that are fueling all of the omnichannel strategies of today and into tomorrow, you have to be able to apply intelligence to the data in order to get to something actionable. That's a really key part. We're also seeing a shift based on everything that's happening in the industry today. We're in this time right now where it's going from precision, especially with the deprecation of cookies coming up. It's my favorite. We're moving towards the idea of precision into predictive, and the role that AI will play in terms of predictive decisioning to create and connect those seamless experiences or defining the next best action, etc., are absolutely critical to also then fueling the experiences that are to come. So the other key point to consider when it comes to exponential is we're quickly moving towards a time where we're going to move away from the mobile device as our primary way of interfacing and interacting with technology. And the thing we have to consider, it's less about desktop and mobile, but it's also about voice, vision, and touch. Those are key. And I like to put this through the lens of what I call the 5 levels of autonomy. everything from chatbots to voice-based assistants to digital assistants to emotive robotics, all the way to Westworld. So let's talk about virtual assistants for just a moment. We have 90 million people using virtual assistants on their phone. The most popular is actually Siri. So when we think about different form factors, about 45 million are using voice-based speakers in their home. And one of the primary use cases is actually 77 million people are using voice-based assistants in their car. And you're seeing the assistants continuing to evolve to basically reflect that idea of ease and convenience in people's lives. Here you're seeing an example of a consolidated concierge approach driven by Google Assistant as you drive. Now, where we're ultimately going, you're seeing kind of an arms race happening. You have Google and Amazon over here who are building this idea of different scenes and services that connect together on the back end, while Apple still wants to maintain control over the applications in the App Store. So that's a key point to watch, because how we see the world evolving for the patient is you're going to see the assistant continue to move to the center of their lives. And individuals are going to continue to offload certain responsibilities to their virtual assistants. What you're seeing in the background is an actual AI, Google Assistant, renting a car on behalf of an individual based on your individual preferences. So it's amazing. And that's just going to continue to accelerate, where virtual assistants become a preference center for patients. The other thing to consider, especially now in the times that we're in, the idea of digital humans or digital avatars that are connected into AI-based systems, or human plus AI hybrids called centaurs, that you're able to completely change how you interact with the patient. But ultimately, where I see this going is what I call the proxy web, to where my virtual assistant can talk to Jay's or to Marjorie's or to whomever's, and we're facilitating connection and conversation on the back end. So any type of interaction that we have will be facilitated by these systems. Think about that from an adherence perspective, from a patient treatment perspective, from how we can kind of connect and check in. And again, it's all about ease. As a marketer, we're going to move from just a consumer or patient-centric approach to a system-based approach as well, to where you're not only marketing or connecting or communicating with an individual, but also with their virtual proxy. And how you basically drive decisioning for either of those changes significantly based on where you are. Finally, let's talk about enhanced. Enhanced is that connection between digital and physical, and again, defining how our environment is going to adapt to us versus us adapting to it. I love The Matrix when it came out in 1999, one of my favorite films. And one of the things that's come out of that is this idea of the simulation theory. Basically, this idea is that we're all living in a computer construct, whether you believe that or not. It's the theory that's out there. But it's interesting because certain elements or aspects of what made The Matrix so interesting is this idea of a red pill versus blue pill, reality versus this fake construct. But you can see now, technology is getting so advanced in terms of being able to basically spatially map areas and apply digital overlays. You can see it on screen now, how the Matrix code is kind of enveloping this entire apartment on screen. So we're going to talk a little bit about perception. We're going to talk about presence, computer vision, digital twin, and synthetic reality. So let's talk a little bit about this idea. I brought up the metaverse earlier. What that is, it's going to basically be the next evolution of the internet. It's going to be highly immersive, but it's not always going to be just through a simple headset. So what you see on the screen right now, obviously, many have tried virtual reality. You've got about 146 million Oculus headsets that are out there and about. Most people consider them a gaming platform. Only about 16% are for gaming. A majority of people are using it for presence and connection. So that's a key point to consider. I have team meetings in virtual reality, so it's a great way to kind of connect with individuals. And what we're seeing moving forward now are more realistic looking avatars. This is from Spatial. So you can basically join into different rooms and create your own avatar based off of a two-dimensional picture. We're heading very close to a time whenever these shared experiences are going to be a new normal for us as we kind of begin to interact. Now let's talk about the physical world for just a minute. Computer vision is basically another form of AI. It's pulling high dimensional elements from your environment and basically processing that and helping to drive decisioning. You see it in Google now as well, even in search. So right now we're searching muscle flexion. What you're able to do is view it now in 3 dimensions. So it's not just hearing and understanding, a two-dimensional understanding of what muscle flexion is. You can actually see it in your room where you are based on computer vision. And this is important because remember at the very beginning, I talked about how the camera is a lens, is basically a way in which individuals view the world. It's an aperture. So what we're seeing now is we're seeing this idea of visual context being applied to the real world through Google lenses. You can simply hold up your phone and it recognizes a specific thing and tells you what that is and gives you context about it. Now, here's where this idea of accelerated convergence comes back into play. What needs to happen for an evolution of experience type? You have to have demand, you have to have the software to support it, as well as the hardware and the infrastructure. We're seeing those things happening now. You've got the rollout of 5G, which allows for lower latency and millions of sensors. You're seeing our world being mapped autonomously on a daily basis. You're now able to take in this idea of volumetric and spatial capture and place yourself either into an immersive world or move the world around you, and then ultimately getting into digital twins to where you can basically take and recreate the world around you. Now, as we begin to close, a few things of note. We're going to be seeing very soon some of the major players and providers offering different forms of smart glasses as a way to kind of connect. You see patents from Apple, you see them from Google, you see them from Samsung and others. And there's the metaverse, but there's also spatial computing and extended reality, extending our physical world. And both are going to play a key role for us as we kind of move forward here in the future. And obviously there's gesture and touch that's going to play a key role for us as we kind of take and enhance experience. So finally, how are we going to evolve? The assistant's going to be moving to the center of the experiences, kind of stitching all these together. When? 2028. We're going to see this massive shift from our mobile devices into these new forms of modalities moving forward. So you'll see the rise of smart glasses over the next few years, and then you'll continue to see these experiences continue to evolve as both the metaverse continues to rise and the role of spatial computing comes to fruition. So finally, how do you future-proof your business? How do you think about patients? It's about planning, predictive, proxy, pervasive. Plan for data, how you're going to structure it for both the patient and for both kind of the core experience for the patient at the center as well as the system. Predictive, that's the AI component, understanding how you tie that into your organization and structure. Proxy, preparing for that connection between both of the systems. And ultimately pervasive, designing experiences that extend beyond kind of your core. So that's it. As you're planning your experience roadmap, think about multimodal experiences, think about predictive analytics, think about how the role of autonomous things plays into it. Remember gaming for adherence, and ultimately the role that spatial computing is going to play in redefining how we connect and communicate with one another. All right, that's the evolution of experience. Jay, Marjorie, team, thank you so much for having me. I greatly appreciate it and love to jump into the Q&A with Marjorie. Thank you.
Well, thank you very much, Tom. That was fascinating, the way you wove together not just technical trends, but also consumer and generational trends. And I have to say that this is probably the first ARF presentation that I've seen that made a reference to waiting for Godot. So thank you for that. I'd now like to ask Marjorie to come forward to ask you some questions about what you just talked about. Marjorie.
All right. Well, thank you, Jay, and thank you, Tom. That was an incredible presentation. So many follow-up questions. I know I only have a few minutes, but I'm going to start off with something you referenced early on, which was that we've seen 10 years worth of adoption happen in 10 months. How do you see those behaviors continuing to shift? And then also, second part to that is, where will they be shifting? In what populations?
Marjorie, that's a great question. I'm seeing it across all generational cohorts. Now, the amount of the time to adopt normally always shifts and breaks down differently. You do see Gen Z and some of the younger generations a little faster to adopt, but I'm seeing adoption rates happening at the 55+ rate faster than I've ever seen them over the last 20 years. So that's a key point. I think the real key element to watch also, remember, it's those three core things. It's the demand, it's the hardware, and the software. The hardware is at a key point right now. The software, we're seeing that democratization of experiences coming together. It really is then around the demand. So the next big inflection point, the next big iPhone moment will be when an Apple, a Samsung, or a Google releases a viable smart glass product. Google Glass didn't really work. It was too industrial at the time, and there wasn't a seamless enough connection into some of these experiences. Now, with the rise of the virtual assistants, that can help kind of facilitate some, that can facilitate some of that, that will be then a key driver for us moving forward.
Great, thank you. You also talked a lot about gaming, and that is particularly in the 55 plus population, there have been a lot of adoption. How should we in pharma start thinking about gaming?
It needs to be in the core of how we think about treatment plans. You know, traditionally it's very much either a paper or something simple to remind someone. I've seen a number of different programs that have been rolled out over the years. What's important is you still need the basic building blocks of an adherence program, but it's important to also consider certain gaming mechanics. There are behavioral drivers for why some of these core elements are popular. So baking that into the approach for how you can drive adherence, working with either HCPs or directly with patients or caregivers even, and kind of gamifying that experience a little bit, can make a profound difference in terms of whether someone actually stays on their treatment plan or not. And the thing that most people don't realize is it's not just Gen Z that's gaming. You saw the stat, 24 million individuals over the age of 55 consider themselves a gamer. That can be a mobile device, that can be any type of gaming apparatus, but the mechanics are there as well.
Great, thank you. Also, that came up frequently is the significant role of virtual assistants. Where in pharma do you think they can be most applicable? There's always a concern about privacy and that our assistants are listening to us. How much do you feel that patients are willing to share, and how much do you think physicians are going to be willing to accept this way of communication?
That's a fantastic question. I think the way that we'll start, it will really start around kind of this idea of differentiated privacy, to where the device is tied to the individual. I know Amazon and others are focused a lot on this kind of pervasive profile, where it understands your voice, who you are, and how that kind of ties into others within your same household. Obviously, from there's a whole regulatory side. We didn't even jump into kind of the privacy side of it yet, but just kind of putting that aside for just a moment. What I see happening is I see virtual assistants being key drivers in, driving treatment plans, information, but ultimately connection and communication. If you've noticed, even in like the Echo Show or some of the other devices, Portal, etc., it's all about that idea of presence and connection. You can now place calls from those devices. You can, send messages from those devices. So as we have to think beyond just traditional email when it comes to communicating with our patient. Are there skills that can basically, either branded or unbranded, help to drive awareness on a specific topic of interest? That's a key area of focus. All the way through to tying into kind of private messaging and kind of different conversational threads that can happen, or even using a conversational AI to help kind of drive a different pathway into a bespoke kind of pre-plan for a patient before they even reach an HCP. So there are lots of different ways we can do it, or even field, pharma field rep enablement. So there are a lot of different ways that we could kind of think about the role of conversational AI. But ultimately, my hypothesis is that they are becoming a preference center for you, and that once opted in, those preferences can unlock physical or digital experiences. That's really kind of the connection between the virtual assistant and this broader idea of our environment adapting to us versus us adapting to it.
So Tom, following up on the role of AI, I've started to see some data that physicians are becoming increasingly more comfortable utilizing AI to help inform diagnoses and treatment decisions. Have you seen anything to show that this is going to become something greater in the years coming, or is there always going to be that hesitancy that AI is still only good as the people who are programming it?
So great question. I think specifically around, that's the specific use case around HCP and AI. And what I've seen to date, you're exactly right. Machine learning is human coded algorithms. So however you're programming those algorithms, however the systems begin to learn, there's always kind of that inherent idea that, well, it may not necessarily fully realize whatever it is, especially when we're talking about something as pervasive as like diagnosis. I know IBM went very deep in that specific area. Now, deep learning, as that field continues to rise and the system is training itself and then running all these kind of concurrent models and everything else, that's a possible play. What I see more for like the patient side and the role of AI is the systems that are going to be enabling experiences, giving them control, basically allowing that idea of ease and convenience, whether that's a virtual assistant in their pocket or whatever that may be. Also, AI is also what's going to be driving a lot of those kind of spatial experiences as well, because you've got actual machine learning on the phone and the hardware itself. It's kind of facilitating those experiences. So it may not be just a direct pathway for patient, but for HCP, there are a number of use cases. You know, when you're looking at everything from clinical trials and some of the information and the data there from a pharma perspective, and really being able to process large amounts of unstructured data, training the models to understand key points of inflection, content resonance from a communication perspective, as you're taking in and analyzing all of this information. So there are a number of applications of AI within kind of the pharma communication patient journey space, but also there's a lot of opportunity for HCP moving forward as well.
Great, thank you. And I think I'll finish up with this final question, which is, you talked a lot about how experiences are shifting and a pending of merging of physical and digital experiences. How can we as pharma marketers prepare for the coming metaverse?
The key things to consider are not just thinking about desktop and mobile and always defaulting to the same channel mix and how you're communicating with your patients. You know, it's important to pay attention to emerging platforms. When I talk about innovation and adoption of it specifically, I kind of take a 70-20-10 approach. 70% of your programs are just kind of the day-to-day, 20% you can measure value, 10% is kind of investment into new and emerging platforms so you can begin to really feel and understand the value that's being created. It's also important, though, to get into understanding how to develop these other experiences. So getting into voice, vision, touch. Most importantly, what is the role? What's the right role for the brand, whether we're talking metaverse, spatial computing, whatever the core pathway is. Again, it's always about aligning with the affinity of the patient and making sure we can drive or connect that next best action or whatever it ultimately is. So it's always going to be a combination of, you know, persuasion plus precision. The role of creative is still going to be very important from a communication standpoint. We talk a lot about data and tools and experience, but creative is still a key breakthrough component for how we actually drive that persuasion. Marjorie, thank you so much. Jay, appreciate you. Thank you to the rest of the board as well and the council, and just, yeah, really enjoyed it.
Well, thank you again, Tom, for a very enlightening and thought-provoking presentation. And thank you, Marjorie, for generating such a great conversation with Tom. I'm waiting for the day when someone will come up with intelligent glasses that also contain a face mask. That would be a real innovation.
There you go.
So please stay tuned then for more Future Health webcasts and podcasts from the ARF Pharma Council. Thank you for joining us on this inaugural look at trends in the patient journey, and enjoy the rest of your day or evening. Thank you.